So hello viewers, welcome to another blog. I'm Dr. Joydev and today I'll talk about hyperkalemia. Now, what is hyperkalemia? Hyperkalemia means there is high level of potassium in blood. I'll be covering this topic in these 8 points. And the last point, the eighth point, that is the most important point, and that is all the foods that should be avoided in persons having hyperkalemia, who are having high potassium level. They should avoid these foods. So stay tuned. And the first point is the normal potassium level. So what is the normal potassium level? Normal potassium level is around 3.5 to 5.5 millimoles per liter, and this normal range can vary a small bit in depending upon the methods of testing of potassium in different labs. So whenever you are interpreting value of potassium, you should always consider the reference range that is provided by the lab, and it will be given uh, by the side of the value of potassium. And if the level of potassium is less than 3.5, then it is called hypokalemia, and if it is more than 5.5, then it is known as hyperkalemia or high potassium level. If the level of potassium is more than 6.5, then it is known as dangerously high potassium level. It can lead to a lot of complication, and among them cardiac complications are the major. Now, who are at risk of developing hyperkalemia? Peoples living with chronic renal disease or chronic kidney disease, they are 3 times higher. They have a high risk of getting hyperkalemia, and they are 3 times more prone to develop hyperkalemia. Now coming to the third point, that is the what are the symptoms of mild hyperkalemia? Sometimes, I rather say most of the times, the hyperkalemia is detected incidentally whenever we are testing for some other purpose. We are getting hyperkalemia, but there is no symptom. So that is asymptomatic hyperkalemia. But sometimes hyperkalemia can cause abdominal pain, diarrhea, or nausea, vomiting like symptoms. But whenever the potassium level is more than 6.5, that is potassium level is in the dangerously high potassium level, then there may be presence of chest pain, palpitation, arrhythmia means there is abnormal rhythm of heart. There may be muscle weakness. So if the potassium is in the higher region, then it can cause these symptoms. Now, coming to the causes of hyperkalemia, the most common cause of hyperkalemia, that is taking excess amount of supplement. If someone is having hypokalemia and he or she is taking potassium supplement, and without any doctor's supervision, if he or she is taking that supplement and he or she is taking excess amount of the supplement, then that can cause hyperkalemia. Next is some medications. There are some medications which can cause hyperkalemia. Among them, there are some diuretic medications. Those medications are used in fluid excess or fluid overload to get rid of excess fluid. But along with that, it can cause sometimes hyperkalemia. So there are some medications which can cause hyperkalemia. If someone is having hyperkalemia after taking those medications, then it is advised to stop that medication and switch to another drug of the same group. Now, how to diagnose hyperkalemia? The most common method of diagnosing hyperkalemia, that is by blood test. We can test serum potassium level. For that we need to take small amount of blood from the anterior cubital region, and that will be tested, and there is no such precautions for this test. Also, indirectly we have an idea about the hyperkalemia by looking at the ECG. ECG sometimes provide us some characteristic features which can indicate presence of hyperkalemia. Now coming to the treatment, uh, there are a group of drugs that I have already told, named as diuretics, that helps us to get rid of the excess fluid that is present within our body. There are some diuretics which can cause hyperkalemia, but also we have to remember that there are some other diuretics which can help us to get rid of hyperkalemia. So diuretics is one of the method of treatment of hyperkalemia. Now coming to the medications, if there is some medication which is causing hyperkalemia, then we have to stop that medication, and that will be the absolute management. Now coming to the potassium binders. Potassium binders are some compounds which binds with the potassium within our gut, and they inhibit absorption of potassium. So that helps in reduction of the potassium level. Now coming to the IV therapy. In IV therapy there are some injections like calcium gluconate. It helps to reduce the effect of hyperkalemia on the heart muscles, and sometimes insulin is helpful, but during management of hyperkalemia with insulin we have to be precautious, and we have to monitor the situation closely, and insulin is usually given in the hospital setup under doctor's supervision. And in case of resistant hyperkalemia, that means there is hyperkalemia but it is not correcting with the above mentioned methods, then dialysis is an option to reduce hyperkalemia. Now coming to the most interesting point of today's discussion, that is, what are the foods that should be avoided if someone is having hyperkalemia. So all the foods which contains high amount of potassium should be avoided. In fruits there is banana, watermelon, orange. These are some of the foods which contain high level of potassium. So these are to be avoided if someone is having hyperkalemia. Now coming to any kind of fruit juice, all the fruit juice that contain high amount of potassium, though, that should be also avoided. Now tomatoes are a rich source of potassium, as well as tomato ketchups. Ketchups are also they contain high amount of potassium, so they should be avoided. And you have to remember that if you are taking some supplements that contains high level of potassium, then those supplements are to be discontinued. So if you like this video, then don't forget to hit the like button, and if you are new to this channel, then you can subscribe my channel to watch health related videos like this. So okay, that's it for now. Till then, take care and stay fit, be healthy. Thank you.